I'm Josie Johnson, and my co-researchers are Allison Lazeski, Cinderella Glava, and Dr. Mary Solomon was our lead researcher on this research project. Our title is Pediatric Immunizations, Resources Used to Seek Information, and Their Influence on the Decision-Making Process. So for our introduction, it seems like more and more parents are refusing to vaccinate their child. There's a lot of misinformation out there that's being perpetuated that is scaring people, and scaring parents, whether it is the ingredients in the vaccine or its ability to cause autism. More and more, it seems like we see in the news a child is getting pertussis or polio and other preventable diseases, so it is a real concern. So the goal of this project is to really isolate where this news and information is coming from, to see if we can change the misinformation and maybe put more truthful information and resources out there at these specific places where these parents are getting this information from. And maybe it can enhance the communication with doctors as well as their patients, and really helping them to understand why vaccinations are important and to kind of dispel some of these rumors at the same time. So the primary objective of the study is to determine which sources are used by parents and their caregivers, who are seeking information about pediatric vaccines, and to uncover relationship between the sources utilized and the general attitudes and beliefs of parents and caregivers who use these sources. The secondary objective is to determine why parents and caregivers are trusting the vaccination information obtained from these certain sources.
The methods of this project involve the development of a comprehensive questionnaire that was designed to gather data about the resources used by participants in searching for vaccination information, how often these sources were utilized, how reliable the participant found these resources, and which they were most likely to consult. A survey also gathered information about the demographics of participants to later be used in the analysis of baseline characteristics. The survey was disseminated via social media and the distribution of flyers containing a QR code that would directly link participants to the questionnaire. Qualtrics' survey system was used to write the questions and house the data collected, and the preliminary statistical analysis was done using Excel. As can be found in the center column, the key findings of this study are summarized by graphic representation. While many of the data were collected for several endpoints, those of greatest concern are reported here. The resources most frequently used by parents and/or caregivers to search for vaccination information included physicians, medical websites, which included but were not limited to WebMD and Mayo Clinic, and pharmacists. In the pie chart, the use of social media is depicted. Most participants did not report using social media at all to look for immunization information, but those that did, Facebook and Twitter were the most common. The star rating of reliability for social media information shows that the average reliability was very low. And finally, the baseline characteristics are broken down by each parameter that was utilized, and it should be noted that the vast majority of participants were women with some level of college education.
The specific results of this study are listed under the discussion section. Doctors' offices and medical websites were the most frequently used sources for vaccine information. Approximately 45% of the participants considered pharmacies as their primary source of information, while schools, friends, family, and television were not reported to be used as the primary source. The survey also included a list of common vaccination concerns for participants. Among the various concerns, the most noted were concerns regarding ingredients found in the vaccines and the possibility of autism. The study had a few limitations, including a small sample size of 137 participants. The study was also disseminated as a link, and one person could have submitted multiple responses. Another limitation of the study is that the results and responses are dependent on how the participant interpreted each question. In conclusion, it is important for healthcare practitioners to understand what resources caregivers utilize in order to make vaccination-related decisions. By knowing this information, we can determine the most effective and empathic way of providing education. This study also revealed that pharmacists are one of the most reliable and frequented sources for immunization information, further supporting the profound opportunity that exists for pharmacists to educate patients and address any potential concerns they may have regarding pediatric immunizations.